Hi guys, so I wanted to do a quick update video on what's been going on, and long story short, I have gotten several phone calls from doctors, whether it be GI doctors, pain management doctors, dropping me because my case is really complex with the neurology part of it and the pelvic pain and all that junk. So, and because I've had so many surgeries, people are really nervous to deal with my case, I guess. That's my only assumption, I guess, about that. But anyway, update on palliative care. I had really high hopes that they would be able to help. And I could tell they tried. Like, they would call and, like, ask how I was doing occasionally. But as in, like, providing pain management or providing counseling or anything like that type of support, like in-person, physical, whatever, support, that never happened. And I had my hopes so high for support. Basically, all that palliative care did was they talked to me, then they talked to my doctors, and then that's where it stopped. From my end anyway, perspective-wise, that's all I saw. And that was really frustrating for me because I had my hopes really high. So just FYI to those who are looking into palliative care, this is completely different from hospice. So palliative care does not do pain management. For me anyway, personally, I did not experience that. And this is with GHS, now called Prisma. They do not do pain management. They do not provide counseling services. They basically talk to you, then talk to the doctor. That's about it. So that was really frustrating. And then my chronic care coordinator, nothing happened with her. Like, she tried to get people involved, but then she turned it back on me and was like, well, maybe this is a psychological issue. And I'm, granted, there's probably psychological stuff that makes it worse, but it in of itself is not psychologically based, because there is physical evidence through imaging and surgical reports and pictures that it is a real thing. And to have somebody question me again, whether it's in my head, that turned me off so quick. So I was really frustrated with her when she's like, nobody else knows what to do with your case. We're trying to talk to people and we're getting nowhere. And I'm just like, hello, why did we hire you? Why were you given to us if nothing's gonna get done? And you're only gonna accuse me. And then she would have the audacity to be like, you know, well, what are you doing for pain management? And I tell her what I'm doing because of what the doctor prescribed, and I told her how much I'm limiting it, and she's like, you know, well, you must be not in that much pain because you're taking X, Y, and Z amount of pain meds. I'm like, no, I am in pain, but, you only gave me a weekend's worth of medication, and I'm having to make it stretch because I don't know when I'll be able to get more, and please don't take me as a pain addict, or like a pain pill addict. I'm not. I really liked what House said in the TV show House MD. He's like, I do not have a pain pill problem. I have a chronic pain problem. You know, like, if you look at my records, I only use the bare minimum, and even that I usually skip because I'm trying to make it stretch. I will try to go for days without pain meds. But because when the physical pain gets so much, my heart can't take it because it has that syncope. If my heart gets too high, then there could be problems later down the road. So I have to cut the pain off. So it's frustrating when she's like, you're not taking much pain meds, you must be not in pain. Yes, I am. And then accusing me that it's all psychologically based and that it's all in my head and just that I am an addict. And I'm like, I just want somebody to listen to me and look at the reports. I'm not crazy in that way. Granted, I'm weird, yes. I have my own personal, personality, and that's okay. I struggle with, anxiety and depression sometimes from pain and from other stuff, but I do not think that's where it is based, and you can tell it's not based there because you see the surgical reports, you see the imaging. There is hard evidence that it's not in my head. And I've heard this from so many girls, and it's so sad because they're told over and over again by doctors that it's all in your head with endometriosis and adenomyosis and things like that. And it's not. And you just want to be believed. You just want some doctor to sit down and be like, yes, I believe you. I understand what you're going through, and I believe you, and I want to work hard to get you better. And I get so frustrated. And I'm letting it out on you, and I'm sorry for venting. I wanted to give you a quick update on that. Anyway, positive end of that, I got words. Hang on, let me get water. Okay, so on the positive end of that, I was told about this place called Arilex Medical Center. I think I'm pronouncing that right. I'm going to put the link in the description below, with Dr.Theofilis. And he deals with everything. He specializes in endometriosis and pelvic pain, but he also deals with migraines, fibromyalgia, different other stuff like that. And he deals with almost all of my issues. He helps people with everything that surrounds my case, except I think for the cardiac issues. But I have a cardiologist who's awesome, who's doing great with that. So that's under control, so I don't need help with that. But the other issues, I've never met another doctor who deals with all of that. With my fibromyalgia, my migraines, my familial hemiplegia, my pelvic pain, my endometriosis, he deals with all of that, which was so encouraging. And the nurses, when I talked to them on the phone, they were so sweet and so nice and just really wanted to get to know you. And two of them that I talked to actually became nurses there because they had endometriosis treated by Dr. Theofilis. So that was a huge encouragement to me. And one lady, I know this is going to sound so stupid, but one lady even remembered my voicemail, which I have a pretty unique voicemail, but I picked up the phone and I called her and I was like, hello, and she's like, oh, hi, Carissa. And I was like, do you have caller ID? I didn't know doctors had that. And she's like, oh no, I just recognized your voice from your voicemail. And I talked to her a couple days ago. And that just meant so much to have that personal connection, which I think is so important and so lacking in doctors. So that that was really encouraging to have that. Someone, and she was like, he actually cares about the patient. He will sit down for I think she said 45 minutes. I don't know. Don't quote me on that. But I believe she said he sets aside 45 minutes to talk with his patients and just sit down and talk with them. And somebody who actually takes that amount of time to sit down and get to know a patient is rare. And they are far and few between. And that really shows their dedication and their compassion and their willingness to actually get to know the patient, not just the disease, not just what their issues are, but the whole patient and their quality of life. And that is so important. So, anyway, I'm going there tomorrow morning. It's in Atlanta, Georgia. I'm nervous about it because I have been to so many doctors who have just turned me away. I'm going to try not to cry. I have been to so many doctors who will just turn me away, or even worse. I would prefer you just turn me away from the start, but even worse, to promise me hope and then drop me out of the blue because I'm too complicated. That hurts. Not just like, you know, you're, as a patient, as a person with chronic illness, you are shown very few moments of hope. And that hope gets yanked away so much that either you give it up completely or you hang on to it so desperately that when it gets ripped away, it's just so painful. And I'm kind of in that tipping point when I'm like, should I even hope anymore? Is there hope still? So going to this appointment, I do have hope that someone might be able to help. And I'm really hopeful. My best friend my best friend said this one phrase one time. She said, I'm cautiously optimistic. And I loved that phrase because I was like, yes, I am cautious because I'm not trying to stake all my hopes on it, but I am optimistic that there will be hope here. And you know, as a Christian, you always have that innate hope within inside you with Christ, because he died for you and he loves you. And you know, you always have that person who cares for you and loves you, which I know even as Christians is super hard to hang on to that hope even in Christ. So I'm not negating that at all, but if y'all could just pray for me for tomorrow, I would really appreciate it, because I really, really want this to work. He has a whole variety of treatment options. I don't know if he necessarily does surgery or not, but just from infusions to injections to medications to different therapies, he just has a large variety of options. And I have not seen that in a chronic care pain management place, to where you have other options for you specifically. So I'm really hopeful that I'll be able to get this under control and managed. I'd like to avoid surgery if at all possible. One, because it's expensive, and two, because it can cause even more damage if it's not done correctly, and even if it is done correctly, it can make adhesions worse. So you always have that 50-50 chance. So I'm trying to do all my non-surgical options first. I've thought about CBD, but I am not financially blessed enough currently to invest in that. I'm hoping once I am able to set a little bit more money aside to try some CBD. If you guys are interested in CBD, definitely check out, I think it's called A Non-Mother Nature something. I'll again set the link below. But a friend of mine, Jill, she has endometriosis and she also has migraines, and she sells through a company, CBD oils. What's really cool about their company is that if it doesn't work or if you don't like it, you can return it for full repay of what you got, which I thought was super awesome, because that was one of the things I was really nervous about with CBD, was I didn't want to, check out a bunch of money and then get no payout and then be stuck with something that doesn't work. So that's also something I'm looking into. So if you guys could definitely pray about tomorrow, I would appreciate it. And I will try to update you all about that and what my treatment options are and what we're going to try to do going forward. So I hope you all have an awesome end of your day and that you all stay chronically strong. Love you all. Bye.